see. Let me get you in. I have its head. There we go. Whoops. Hold on. There's its little face. There's its arm. It's going like this to its head, giving itself a little hit. Let me see. Trying to lengthen the baby out, because you know where it's facing? It's facing...
Its head's down,
that way.
Oh, okay, I see.
It's facing all the way sideways. So I'm just trying to see if I can get the baby to come all the way. There we go. I've got it. Now I've got it. It's upside down now.
That's funny.
There we go. It's kind of curled away from us. So I have the head, its back is curled. There's its legs. You can see they're kind of tucked a little bit. There's its little foot. See if we can get you in a little bit better, baby. There we go. That's a nice long baby.
Yeah. It's nice at least that we can see it moving, since it's tough to see the heart where it is.
Let me show you what we have, okay? So we have the baby's bottom, its back, its head. These are its bony fingers.
Oh, okay.
That's its fat tummy. That's its little leg and its foot. Its heart is right there. But since I have a still picture of the baby, might as well measure how long it is. Sometimes when I stop this, it's right on target, 11 weeks.
Okay.
It's 42 millimeters, so about 1 3/4 inches.
Okay.
And that's perfect. So that looks good.
And I'm assuming if you're off by a day or so, it really doesn't matter.
You can be off by about 4 days.
Okay.
You know, because the thing is, the baby's not straight.
Right.
It's kind of curled in there.
Right, so it's all a little bit relative.
It's not. Let's see. Now, did you move on me again? Alright, now I'm going the other way with it. Again. Trying to get it all in.
There's a little heartbeat.
See the little heart, yeah. You see its little profile?
Yeah.
You can see right over here is the baby's mouth, baby's eye. If I go like this, I get a little bit more of the nose. Still a little handy. It's sitting up there near its little face. So right now it's kind of stretched out there. So I guess see its little leg kind of stretched out. So I guess while it's quiet for a second, maybe I'll go ahead and do its little heart rate, and then we'll see if maybe I can get the baby. Oh, there's its little face. Maybe I can get it to go ahead and move once I stop everything and measure. Let me see. Where's my little line? There we go. I don't know why the image is jumping, but okay, so I have a little heartbeat. It says the baby's at 142 beats a minute.
Okay. Is that pretty normal, or?
Very normal. 120 to 180 is normal.
Okay.
So usually in the very beginning, the baby's usually pretty high.
Yeah, I think it was up around the 60s, 70s.
Yeah, and that's because it was growing all of its things. Once it hits about 11 weeks, it decides where it wants to settle down to.
Okay.
So it's going to be anywhere, like I said, from about 120 to about 180.
Okay.
There it is. Nice, cute little face. I like that little picture of its face. So sometimes they say the lower the heart rate, boy. Sometimes they say the higher the heart rate, girl. You can kind of see its cord. It's right there, coming out of its tum-tum. And it looks like it's implanting right around there.
And about how big is the uterus right now?
Your uterus, I'll have to measure it. Just because I haven't measured. There's this little bladder. It's got a little bit of pee in it. That's a cute little picture, too. And you still see the little fingers sitting near his head. Let's see.
So the thing up by his head, is that his arm?
That's his fingers.
Oh, those are his fingers.
Those are his 5 bony fingers, or her 5 bony fingers. Looks like the uterus is measuring at about 67 millimeters. So it's probably about 3, not quite 3 inches.
Okay.
For the actual uterus, so
right.
About like that
pretty
big,
small.
which is pretty normal because the baby's not measuring quite, you know, not even quite 2 inches yet. It's about 1 3/4 inches. So
doesn't need that much
it just
room.
has all that extra muscle. We'll see if we can get the baby to move a little bit. So there's a good picture of the baby in this thing. Sometimes, yeah, we'll do a little, hello. You wake up? Baby. Give you a little jiggle. Hello.
It's out cold.
I know. You see his cute little face. Can you see both the eyes there? An eyes, the nose, the mouth, the other eye.
Oh, okay.
Can you see it?
Yeah, looking at
Yeah, when I
us.
take the picture, you'll see how cute it looks. You'll be able to look at it when we actually do it. And I'll show you.
Funny.
Let's see. Are you going to wake up? Or you just nestled in for today? You can see his little spine. It looks pretty good.
She's like, trying to sleep here, thanks.
I know. It's like, Mom, what are you doing? I'm sleeping. Look at his leg. See that long leg?
Yeah.
Long little foot?
And then what's at the top of the screen right now that you, when you did that angle that you could kind of see left over? Oh, no, it's gone, I think.
There's his hand. Maybe it's this little ring. That's a sac around the baby. A little amniotic sac. Its arm again, as you can see.
Oh, yeah, so, is that the
part-
heart we still see right there?
No, that's
When it's-
part of the cord is curly.
Oh, okay, so we can see.
There he
there we
goes.
go.
There she goes. There you go.
No, just readjusting, thinking, what in the world is happening?
Yeah.
That's incredible.
I know, isn't it? It's so cool that you get to look inside and see
Right.
what the
Those
baby's
little
doing.
legs.
I know.
That's incredible.
It opened its little mouth there. It was so cute.
That's,
Still has this little yolk ring behind it,
oh,
see?
yeah. That's his favorite little spot right there, nestled in.
It likes it right there. Oh, look at your little leg.
And his little hands.
Yeah. Oh,
That's
cute
incredible.
baby.
That is
Isn't it cute? And it's
unbelievable.
yours.
I know, right? It's so crazy when you actually see it in there and then you realize all of a sudden that it's actually in there.
It's in there and it's alive and
Yeah.
it's real and
I always
you
love the
can't feel
ultrasounds because
it.
you're like, oh yes, it's still,
It's
you know, it's
still
still the
there.
heartbeat, it's moving,
Yeah.
it's still there.
the baby's doing great.
So after that 8 to 10 week point, do your chances of miscarriage go down even more
Oh,
once you make it through
tremendously.
there? Okay,
Mhm.
cool.
You probably have less than 1% chance of
Okay.
miscarriage where you are right now.
And at this point, it's probably more just a spontaneous, no real good
A
reason for it.
spontaneous event, right? Every once in a while, rarely, maybe somebody, if there was something chromosomally abnormal,
Okay.
maybe like a Turner's syndrome,
Okay.
meaning a girl baby that had abnormal chromosomes, sometimes they may succumb,
Oh,
you know,
okay.
at 5 months, but you're
Right.
not really looking at, you know,
And we did the
microarray and
microarray.
looking at your age, you know,
right,
your risk of chromosome abnormalities is so
pretty
low.
low.
So you should feel pretty confident that the baby's going to do well.
That's good.
Yeah.
And then how do my ovaries look? Are the cysts down quite
Yeah.
a bit?
This is the ovary over here.
Okay.
You have still just a little bit of fluid, you know,
Not
behind
bad.
the ovary, just a little bit up there.
Okay.
So this, I did see the ovaries when I came over. There's your other one right over there.
Okay.
You have one cyst left. Are you
Okay.
feeling a little bit of pressure on that?
Is that the
One
left side or the right
yeah,
side?
the
left
left.
side.
Yeah.
Yeah, occasionally.
It's about 38 inches, so it's a little bit bigger than your ovary. You know,
Okay.
the full size of the ovary, that one particular cyst. So.
Okay. Yeah, occasionally I have little cramps here and there, but nothing
And it should
bad. And some of
still
it might be my uterus anyways.
growing, and you know, if
Right.
you have that heavier cyst on the ovary, the weight of the ovary, the weight of the uterus, now as it's going to start to approach rising below the pubic bone,
Right.
you know, after 12 weeks it starts to come up and everything, so you
Right.
might feel a little stretch on the ligament there that supports the uterus
Okay.
and holds on to the ovary, you know,
Right.
to keep it close to the uterus,
Right.
so.
Yeah, I've had a little more cramping the last couple of days,
Mm-hmm.
but not even...
Nothing really...
No, I mean, they come and go.